The sounds of MV avec Zoé sur le Pure 907 Seychelles. Love life and more music, ladies and gentlemen. Like I said earlier on, we do have a special guest that is coming. A man, they're being brought to us, by the way, by Miot International. Of course, you know Miot International as a place whereby you can get all your medical needs looked after. Last time we had a lovely doctor that came in and she was talking about myopia, the eye issue, which I found out the technical term, which of the eye disease that I have. Well, the eye issues that I have, rather. So yeah, I'm myopic. But today we have somebody else, Dr. SP Kurinjinathan. He is somebody that is he has a lot of well documentations. Like he has been a psychiatrist for over 22 years. He's been in the field almost 2 decades of these heavy lifting. He has worked for the Royal London Hospital, East Ham Memorial Hospital, Brooklyn Child and Adolescent inpatient, all in the UK. Runwell Forensic Medium. You have expertise in child, adolescent, general adult psychology, geriatric, forensic psychiatry. This is a very impressive list that you have right here in front of us. Welcome, Dr. Kurinji.
Thank you, Derek. Thanks for that lovely introduction.
I was just saying, you had to mention all of these. This is impressive. But 22 years you've been here. Can I ask, before we get into all of the things, I know we're going to be talking about autism, addictions in just a little bit. Before we get into that, can I ask, what pushed you into the field of psychology?
Okay, that's a very interesting question.
Yeah.
Okay, I was doing medicine.
Yeah.
Because when you're trying to become a doctor, usually you think about becoming a cardiologist or an orthopedician,
yeah,
or some traditional, like what people say as doctor. But while doing third year, we had to go to the local psychiatric hospital for posting, and then it just kind of completely floored me. Because you couldn't understand what is what. So by being curious, I just wanted to understand why certain people are certain way. That curiosity led to me choosing psychiatry, and I'm grateful that the natural forces of the world has helped me land there.
That's what's up, man. That's very good. I have a similar story, only it wasn't at medical school. I was doing my A-levels, and I was like, psychology, what's that? Let me choose it. And I mean, I knew, I've seen it in movies, like what it is, but I want to understand it more. I want to know how people think and how people are.
And I was very kind of, moved when you said, you're also a fellow traveler, exploring the human mind. So
it's very good. It's always it's very nice. When I saw that I was interviewing somebody with a psychological background, I was like, oh, that's what's up. I was very very happy to see that. Can I ask, how long have you been with Miot International?
Okay, I've been with Miot for the last 3 years.
Okay.
Basically, I did my medicine in India. In Chennai, I did my medicine in Madras Medical College, which is almost like, I think, 150-year-old hospital, the British, built by the British. After finishing MBBS, I went to UK for further training, and I lived in UK for 22 years, from 97 till 2019. And 2019, I thought, okay, I'll move back to home country, see what I can do, because home is home.
Yes.
And then Miot MD, Dr. Prithviman Mohandas is a close friend of mine. We studied in medical college together. And we thought, now the stigma around mental health, we have to do something about it. And Miot and me, good for 3 years, and we want to kind of push the boundaries of understanding about mental illness further and further.
That's very good, and it's cool that you guys have decided to push that boundary with mental health. It is something that the more we move with time, the more we realize the importance of mental health with an individual. The more we understand about psychology, the more we see the necessities for mental well-being. Right? Is that one of the reasons that you have come to the Seychelles? Has there been like a need whereby we say, this is something that the Seychelles, there's a need for it, let us go there?
Yeah, I mean, Miot has a long presence in Seychelles, and since we are already here, from other patients asking questions around mental health. We thought we'll add to the service because I understand there's already a good setup here. But we thought we'll come and add to the population with the knowledge and expertise that we have, because we have a much larger team in Chennai with us, not just only psychiatrists like myself. We have psychologists, speech therapists, even other medical specialties like liver specialists and neurologists, because sometimes mental illness overlaps with neurology. So we have a much bigger team who can provide a very holistic, wholesome service.
Yeah, I can see right here, professional counselors, you got speech therapists as well, occupational therapists, recreation trainers, nutritionists. So it seems like you guys have a very dedicated mental wellness team put together, that you're ready to put in the necessary work here in the Seychelles. Now, before we go into the hard details of autism and addiction, I just want to ask, are these the two areas that you guys have spotted here in the Seychelles? You say people have been asking questions related to mental health. Where are these like strong points that you notice here with the Seychelles population?
I mean, mental health is such a vast area. You can start from anxiety, mood disorders, psychotic illness, and all of that. But I think the feedback that we got was that these are two areas where we could add value.
Okay.
Child development, mainly autism and ADHD, and again, addiction is becoming more and more common all over the world.
Yes.
So we thought, we'll provide a service.
All right, that's very good. And speaking of a service that you guys are providing, I do see that between the 26th of February to the March 2nd, you have this free counseling sessions that is happening over at the MIOT International Total Eye Care, the ground floor of the Espace building, whereby you guys are going to be counseling and seeing people.
Yes, I'm here. This is the first visit for me to kind of build up some awareness, and then I'm planning to come every 3-4 months, do follow-up clinics, and also provide teleconsultation services for people who have queries. I can see them through teleconsultation and provide counseling services or prescription or assessments, whatever people need.
All right, and just you mentioned it, interventions, right? Teleconsultations. Is this something that's been proven to work, right? This is something we see happening a lot nowadays.
Yeah, I mean, very much so, because like pre-COVID, this teleconsultation idea was not something that anybody kind of talked about, especially in mental health, because the one-to-one connection is very important.
Exactly, right?
Okay, so, but COVID forced people into having more and more online communication, and I think the app Zoom, nobody has heard about it, before that. Then, like within 3 months, like everybody is on Zoom. So after that, what we found out is it's actually providing, rather than getting no help, the online sessions are providing a valuable service, and people do benefit from it. And now a lot of people actually prefer it, because it stops them from traveling for 1 hour to reach clinic and then have to travel back. So now people have very advanced phones and systems. So after the first contact, it's quite easy for them to build rapport, even online. So I mean, a lot of bad things with COVID, but this is one thing that came out of it.
Wow, that's very cool. The fact that how medicine and the field of psychology has advanced to this point, whereby now you still can get your one-on-one sessions. Yes, it is through a device, but at least you are getting the help needed. And of course, if there need be, you do provide face-to-face consultation eventually as a supplementation to teleconsultation. That's absolutely great. Anyways, guys, we'll be right back in just a little bit. We'll put on a short break. Stay tuned in. Don't go nowhere. It is your man, Khalil Hippie. This is the 907 Express, and we are having an interview with Dr. Kurinjinathan about mental health. When we get back, we're going to talk about autism, ADHD, and addiction. Stay tuned in on Pure 907. Yeah, call vite avec l'homme matinale. C'est le Pure 907 Seychelles, Love, Life, and More Music. 36 minutes past 4 in the Seychelles, and we do still have Dr. Kurinji. I can call you Kurinji, yeah? All right. We still have Dr. Kurinji here in the studio with us, and right now we're going to be addressing addictions and autisms and ADHD. First, addiction. Now, I have to know, what is addiction? Like, we hear this word a lot. We hear a lot of people talking addiction. They say, oh, that person is a drug addict, that person is an addict. But what is addiction itself?
Yes, that's a very good question, because a lot of people use alcohol, but not everyone is an alcohol addict.
Yeah.
So what, medically speaking, for addiction you need to have three things. One is craving. So when you don't have it, you have to crave for it.
Okay.
Then the second thing is you develop tolerance. So what you start with, your body gets used to it. So you need to increase it more and more. So that's the second bit. The third is withdrawal symptoms. So when you don't have it, the body starts to show a lot of withdrawal symptoms.
Yeah.
So if it is present in any behavior, then that's an addictive behavior.
And so these three things are the specific things that we are looking for. It doesn't matter what the behavior is.
Yes.
It doesn't matter what the substance is. If that is the reaction that we're getting, addiction is present.
Yep. So that's why even mobile phones are addictive.
Which is good, because my next point was going to be like, what are some of the different addictions that you do know or you've seen in your time?
So the common ones are alcohol and drugs.
Yeah.
Opiates is one of the strongest addictive drugs. That's why in America now you see
the
opiate poisoning. Deaths. It's just
it's an epidemic right now.
It's a big issue there.
Yeah.
So apart from alcohol and drugs, you have certain behaviors which are like gambling, for example. Okay. And people with gambling addiction lose a lot. The families get destroyed, livelihoods. So it's sometimes as bad or even worse than some of the alcohol or drug addictions. Then you have now the thing that's I'm seeing more and more is children being addicted to phones and getting into a lot of behavioral difficulties. If I can expand,
yes,
like if you Google, you'll see in China every year 1 or 2 young person actually dies of gadget gaming addiction.
Really?
Yeah, because basically the games are so incentivized to play continuously.
Yeah.
They wear nappies, they don't go to the toilet.
Oh my God.
And some of them even put IV drips so that they don't have to go and drink or eat.
What?
And then they play game continuously. And I would, the viewers, listeners, please you can Google it and check. And now de-addiction centers for gaming is a big business in China.
Damn. Like, okay, I knew gaming was a big issue in China, especially gaming addiction, but I did not know that it was going to those lengths.
Yes.
Wow, damn. And here in the Seychelles, I think we're seeing more and more having a gaming addiction, for example, right? Okay. Especially with the younger kids, whereby I don't know. Correct me if I'm wrong. I see that there is this raging that's developing with these gaming addictions, whereby they're playing a game and then they're just raging out and smashing things around. Is this like one of those symptoms that we see common with addictions?
Yes, it's like imagine you have an alcoholic. Yeah. Okay. They have a can that they bought finally. Okay. Yeah. And you go and grab that can from them. See how they would react.
So it's the very same.
It's very same. So a person who's addicted to gaming, you go and grab their phone or their video game set, they'll kind of
they'll lose it. But this is the thing, though, and this is one thing that I've witnessed, right? It's not just the grabbing of the system from them. Sometimes the grabbing of the system from them helps clear it. It's the gaming itself. These guys are right there. They're gaming. Something is happening in the game. They're raging with it.
And the thing is, I hope I don't get sued by gaming companies, but these games are designed to be addictive.
Yes.
Okay. So parents are fighting against $1 billion industry.
Damn.
Okay. So because in the games, what they do is like they put incentives every now and then, so that the person playing gets a dopamine hit.
Yeah.
Okay. So if it's too hard for you after 2 or 3 sessions, you will find out the next session you are able to cross it quicker.
Yeah.
Now with large data, AI, all sorts of stuff, the phone knows what stage you are in and which are the easy bits, which are the difficult bits, and if you haven't played for a few days, they will make it easy for you, so then you get hooked on it again.
It's crazy, and to have an industry that capitalizes the opponent is like, this is how we're gonna make our money. This is sad. And let's move on to gambling addictions. Like, what are some of the causes that leads to gambling addiction? Do we know?
Okay, See, most addictions has a genetic component.
Yeah.
I think in gambling, what they have found out is we have different neurotransmitters and have different type of receptors. The dopamine receptor, one of the variant, is slightly affected. So people with gambling addiction, they found out that is one component. So genetics plays a role.
Okay.
But genetic alone doesn't determine that the environment has to be there. Like for example, you might be an alcohol addict. You might carry the genes for alcohol addiction, but if you're going to live in Saudi Arabia, which is a dry country, you're not going to be addicted to it.
Yeah.
So for gambling, if you carry the genetic risk, and along with it, if there are opportunities, then the risks are higher.
All right, so so the environment you're saying plays a great role as well when it comes, especially if you have the genetic markers for addiction, like gambling addiction, for example. Where Seychelles is such a small country. I know you're fresh here. You probably still got some work cutting and some research to find out. But how would you help change the environment of such a small place, like to go when it comes to a gambling addiction?
Okay, I think you have to work with the families.
Okay.
Because what happens is with gambling with most addiction, people lose their control after a while.
Yeah.
Yeah, because the brain itself changes. The addict's brain functions differently to an average brain.
Okay.
So, for example, if basically, like, we sometimes give too much weight to willpower. Okay, but along with willpower, we also need to make sure the environment is conducive to carry out that behavior. It's like people losing weight. If the fridge is empty, if they have to go to the shop, they won't be snacking. Like that, if there can be restrictions for somebody's been found to, somebody's known to be an addict, say gambling addict, then I don't know in Seychelles what the regulations rules are, then people can think about how to restrict access for them to kind of gamble. So gambling is a fun activity for the majority.
Of course, it's existed for eons of ages.
But there are some who are vulnerable, and those people need to be protected.
That's exactly true. Like exactly, we're not saying gambling and stop all of it. No, we're saying there are some people who are at higher risk of becoming addicted to such activities, and therefore limiting those risks is something that we should cater for. And so policymakers out there, if you're listening, I'm just saying, maybe it's something you guys should look into.
Yeah, in England, there's what's called like pinball machine.
Yeah.
Okay, and they've found that even a lot of young boys were kind of putting pennies into the pinball machine and getting addicted. So then they basically said, like, we can't have those in kids amusement areas and all things, so they stopped it. So
little things like that, of course. And right before we move away from the ideas of gambling, I just want to touch like one more thing that is extremely addictive. Like we talked about gaming addiction, we talked about gambling, we said any form of drugs or alcohol could be something that causes addiction, especially if you have a genetical marker for it. Addiction to the phone itself, social media addiction. This is another big thing and something that we see here in the Seychelles. It's everywhere around the world, right? But as we see it rising, what are some of the things that we can help to combat that? I mean, we could take away the phones, but as a professional, do you think it is primordial that laws be changed again to protect the innocent?
I'm sure probably in like 5 years, 10 years time, there will be laws restricting the use of mobile phones. Probably it might start in northern European countries like Sweden, Denmark, because they are more particular about these things. Because what happens is young people's self-esteem, everything gets attached to the feedback that they get from the social media. So it's actually studies have shown that people who spend more time on social media are more depressed or have low self-esteem, that kind of things. So the harmful effects are becoming more and more visible. So the companies are trying to kind of find ways to, recently the US Senate had a hearing where Mark Zuckerberg came and talked about Instagram for kids and how because it's the report, when last when I heard about the reports, it was funny when
these guys understanding that social media has hits the same spots in your brain as gambling whenever you're gambling. The same spots in the brain lights up whenever you're going on social media. And it was one thing that baffled me, the idea that they would change the way the app operates to mimic more of the gambling, just so that they can have more eyeballs on that. So it's at some point, companies have to be more responsible towards the people that they are providing services to, and instead of pushing them more towards the addiction for profit, I think it should come to a point whereby as medical teams and people in the world should step up and be like, hey man.
Yeah, I agree, and I honestly think it's only a matter of time.
Yeah. Great. I can't wait to see that happen, because it is especially big issue in the field of psychiatry. You probably see a lot of cases whereby young people the addiction to social media and their apps and gamings and all that. So before we move on, what are some of the signs that we need to watch out when it comes to addiction?
Okay, so the first thing is craving. So you start to think about that one particular thing longer and longer.
Yeah.
To the exclusion of others.
Okay.
So you might have varied interests, but over time you find that you're only thinking about this one particular thing.
It's narrowing down.
Yeah. So if that starts to happen, then you need to be careful. The second, you are getting more and more the tolerance bit. So what used to give you pleasure isn't giving you pleasure anymore. So you need more and more of it.
Okay.
That's another bad sign.
Okay.
You need to be aware. Then definitely, if you have withdrawal symptoms, you need to seek help.
Okay, so let's say you are family members, and a lot of people, they might not see the signs, right? If you are a friend or a family of somebody who are going through the stages, what are some of the things that you could spot with your friend or with your family that could help you say, all right, maybe I should talk to the person or intervene before they get sucked into it?
Yeah, I mean, the first thing is like probably the contact with you will start to lessen.
Okay.
Because they're spending more and more time on that particular activity. Then second, they might also start to ask for money for different things. They'll say, I have this particular problem or that particular problem. Just lend me this, lend me that. And either that's to get drugs, alcohol, or for gambling. They need money, so people start to ask money from near and dear. If that is happening, and usually it happens so stealthily and secretly, so all the different family members, when they finally find out, they're like, why didn't we talk to each other? So
communicate with each other.
Communicate with family. Just check if you're worried about one of your family members. Seeing them starting to isolate themselves, or
So keep an eye out, people. You heard it right now. Keep an eye out for each other. This is something that, again, we lose in touch with in this world, whereby everybody's just having their phones in front of them, in front of their faces. Put it down for a little bit and look at your people and find your connections, and realize when you have somebody that might be straying down a path that's not going to benefit them, their mental health in the long run. Please, you got to look out for each other. We'll be right back. We're going to take a short break in just a little bit. We're going to continue, and this time moving on to autism and ADHD. Stay tuned in right here on Pure 907 Seychelles. Yes, that was Precious Pipala, ladies and gentlemen, with Eve, the Pure 907 Seychelles. Love, life, and more music. Welcome back to the show. 5 minutes past 5 in the Seychelles, and we still got a great show lined up for you guys. 5:35, we do have that hippie experience, a tale of the unlearning coming up, and we are still doing that little dive to compare societies, what it means to be an authoritarian society and a collectivist society, and even in those, there are issues. We're going to use Aldous Huxley and George Orwell's 1984 to contrast each other. What else do we got? Great music, Auspicious, Hosier, Knox, Ludacris, Master ML, Dispromotion d'Etoile, and of course, we still have the great Dr. Kurinjinathan. Kurinji. For a minute there, I thought I'd say it wrong. Still in the studio with me. Now, Doc, I know I've been taking a lot of your time, but we still have one major topic, one major thing for us to discuss, and it is we want to learn more about ADHD and autism, right? Let us kick off the box. A lot of people hear a lot of it, and a lot of people have explained a lot of it, what it is, but in a nutshell, autism and ADHD.
There are two different conditions. Autism, or what's called as ASD, autism spectrum disorder. It's more a social and communication disorder.
Okay.
So the young children or adults, they have difficulties in socializing or understanding the social nuances, and they have difficulties in communication, and sometimes they also have very rigid and repetitive behavior. So that's autism.
Yeah.
This is a separate condition. People or children with autism can also have learning disabilities, can also have sensory processing issues, can also have ADHD, can also have other difficulties like anxiety, depression. But ASD on its own is very separate. Whereas ADHD is, as it says in the tin, attention deficit hyperactivity disorder. Their attention span is so short, they get bored very easily, they get distracted very easily, they can't sustain their attention to learn new things, and also they're very hyperactive and fidgety. They can't sit in the classroom for too long. They can, what they call as ants in pants.
Yeah.
They're just kind of moving around. So that's ADHD. So these are two different conditions, both developmental, affecting young children.
All right, so you've mentioned like the whole attention deficit hyperactivity disorder, how we have attention spans being short and everything in this day and age, in this day and age where we are right now. It would seem that there is a rise. Is it me, or is there a rise in ADHD levels?
Okay, no, it's not you. And see, it's difficult to differentiate the clinical ADHD to now the shortened attention span because of people using mobile phones, and people used to read books.
Yes.
Then it reduced to reading pages. Okay.
True.
Then it reduced to maybe YouTube videos for 3 minutes or 5 minutes.
Yeah.
Okay. Then it reduced to 1 minute videos. Then it got to TikTok and like 10 seconds, 15 seconds. Okay. So even that 10-15 seconds people are not watching. 2 seconds they just swap right, left, whatever. So the general attention span in the society itself has gone down. Whether it reflects as ADHD, we don't know yet.
Okay.
But for young children, it's easy because in classroom, how they are, that's what we mainly base it on.
Okay, that's good. Or rather, it's good that we understand that the difference between actual ADHD, that is it genetics when it comes to
ADHD? There is a genetic component to it.
Right, versus this attention span, this shortening of attention span that we've seen in society. I was always a bit curious to see if it is linked, because right now you have a lot of these young kids, a lot of these people, again, because of technology, they have more information at hand, and you have a lot of self-diagnosis happening out there. A lot of people coming like, hey, I'm ADHD, I just found out I'm ADHD. Is that a problem when it comes to actually dealing with ADHD?
Yeah, I mean, we do get a lot of questions around it. Excuse me. So how you basically ADHD, you have to diagnose it at childhood. Now there are adult ADHD clinics coming up a lot. How the main thing is how long can you sustain your attention in a productive task. Okay, so you can have very successful people with ADHD, but if you ask them to write a 5-page dissertation, they can't. Okay. And even their handwriting, if you see the first 3 lines, the shape of letters are okay, but by the end of the page the letters are all gone, because their attention span, they're getting distracted, they can't sustain it. So that is different. Whereas general population, I would advise, like reading books, playing chess, deliberately you can train your attention to last longer, so that your brain can handle boredom.
Okay. That's interesting. The fact that you can actually train yourself in all of this to be able to compensate for the lack. Now, what are some of the signs that, other than the classes you say shorten attention span in the classrooms? Now, are there things that can be done to once we start identifying kids with ADHD?
Yes, please. And also the other thing you notice is teachers would write in their feedback, if only he could concentrate better.
Yeah.
Okay, and some kids, they read the question so fast, they make mistakes. They know the answer, but they made silly mistakes.
Yeah.
So they underperform.
Yeah.
So it can present just that
Alone is.
yeah. Could be an indicator. And the other things are like, because they are hyperactive,
Yeah.
okay, they get into trouble a lot.
Okay.
And teachers constantly have to call out the name of the kid.
Yeah.
I don't have Derek, like when you are in the classroom, your teacher says, Derek, please sit down. Derek, don't move that. If that is the case, if your kid's name is being yelled at by the teacher a lot, have it checked.
Have it checked, because there's a possibility there that it might be some ADHD that is going on. All right. Things, little signs that we should, as parents, pay attention to. Okay, so it translates at in the home as well, right? Because
Yes.
we've talked about the classroom right now setting. In the home, does it translate the same way? Lack of attention and hyperactivity in the home.
Yeah.
That's another sign that maybe bring your kids, have them get a checkup. Like it could be nothing.
Yeah, most scenarios, like below the age of 6, we don't test too much,
Okay.
because kids can be kids till
Yeah.
the age of 6.
Yeah.
Once they are in the classroom setting, that's when it starts to have an impact. So that's when we need to intervene. And even though generally we don't use medication much in children, but for ADHD, medication do wonders.
Okay.
It changes children's life.
All right.
So, for example, if your potential is, say, like to get 80 out of 100, and if you're only getting 50, 60 because you're making silly mistakes, because you're rushing things through, then medication can get you back up to show your full potential, your true potential.
That's what's up. Now, we're talking a little bit about ADHD. We've also mentioned autism, or rather the autistic
spectrum
disorder.
Yeah.
Tell us a little bit more about the disorder.
Yes, the reason why we call it autism spectrum disorder is because at one end of the spectrum, you can have children with no speech. Okay.
Yeah.
And socialization is so difficult. They can't tolerate anybody's presence, and they have so rigid in certain things. They can't function outside of that environment.
Yeah.
And on the other end, you can have people on the spectrum who nobody would even know that they have a difficulty.
Okay.
In older days, people might think you're just a bit aloof, or you're a bit of an eccentric, and that's about it.
Yeah.
But people can function well if the social difficulty. See, for example, if you're socially, awkward and difficult, if you're in a job which doesn't involve too much social interaction,
Yeah. You're gonna be just fine. Yeah.
Yeah. So it's the impact on your life. That's what whether you need to kind of get help.
So when it comes to autism, then basically what you're saying, depending on where you are at on the spectrum, there's a high chance you can have a normal life.
Yep.
Depending on again the circumstances of what it is you're going through, and what it is the situation that you do up in when you are working in life, right?
Yes.
And it is again, I mentioned that about ADHD. We see a rise in the prevalence of ADHD, autism as well. We are seeing the very same thing happening around the world right now. Is it that is it a case of where I have more autistic cases coming up, or is it that we are becoming better at identifying it, and now that we have a spectrum, understanding that there is a scale, it plays a difference?
Yeah, I think we definitely have more awareness now.
Okay.
And there are, for example, 50 years ago, people wouldn't talk about depression or anxiety.
Yes.
Now it's a bit more common. Similarly, autism, now people understand it better. ADHD, people before, if you're an autistic child, they would just call you, names which I can't, because that's very kind of, insulting. And if you have ADHD, you're just seen as a naughty child. Okay. So that's definitely more awareness, more understanding. That's why it looks like as if it's more.
All right. And can you tell me about some of the associated challenges when it comes to autism, right?
Yes,
when you're somebody with autism, what are some of the challenges that you're going to be having in your life?
So to start with, even starting in nursery, because the child has difficulty in playing with other children, they are more isolating. And if somebody goes and interferes with their routine, then they can react badly. So that leads to problem even in nursery or in creche. and sometimes they don't make eye contact. So because people are not making eye contact, that gives the wrong impression, that you're a bit shifty or you're telling lies, all these cultural understanding about eye contact. So when people don't make eye contact, that can be seen as a problem. And also in communication, sometimes they don't get the right words. So they may mean different, but it will be understood differently. And also children with autism or people with autism spectrum, they don't read between the lines. It's very concrete. So there's room for misunderstanding when it's not communicated. Like even day-to-day life, we see, when people send text messages, sometimes the nuance and the context is missed, and people get offended. Okay, then you have to go and explain, apologize. No, I didn't mean that. I didn't mean this.
Message.
So communication can go wrong anytime. With autism spectrum, it has a higher chance.
Higher chances of going wrong. All right. And what are some of the associated challenges when you are a parent with a child with autism?
Again, if you don't understand the child, then everything becomes difficult. Because if you want your child to behave like every other child and try to force the child to conform to what is seen as norm, then that will lead to conflicts. Okay. Whereas if you understand, okay, this child needs this much level of support, and also sometimes they have sensory issues, so they can't hear certain sounds. So they'll put their hands to the ears, and sometimes their sensitivity to smell is high. Sometimes the texture, so they when they eat food, they're very fuzzy.
So little things that's going to be a challenge.
And the children who are used to their fixed routine, if you change the routine, it goes. So if you're going to the school at the same route, if you change the route for whatever reason, they'll have a meltdown.
Issue. All right. And what are some of the ways that we can help manage autism in life?
Okay, it's very child-based, because there is no one autism management, because each child can present with different and difficulties. So child with speech difficulty, we'll address it through speech therapy. Okay. Child who has social difficulties, we do with social stories, help the child develop a better understanding. Okay, so that they're able to function better. And for some children, we just need to build their independent living skills, so that when they're adult, they can look after themselves, they can budget, they can go to the shop, do whatever needed. And in work environment, I'm sure, like there are a lot of people within the spectrum, within Seychelles, who are functioning well, who are doing their work. So understanding the child, in very rare scenarios when there is challenging behavior or other symptoms, then we might need medication.
All right, and this is something that's happening a lot here in the Seychelles right now, with you coming in with Me Arts International, providing these services. These are some of the things that we are to expect, like medications and then taking care, because a lot of parents might feel like, medication, what are you giving my kids, and all that. What are some of the, I don't want to use the word guarantees, but some of the things that you can put out there to reassure the parents?
Okay, before medication is we do thorough investigations, get detailed history, engage with the family, try to manage the child without using medication through psychological means and behavioral means. It's only in extreme rare scenarios, sometimes we have to use medication to help the child function better. Okay? So it's done after very careful consideration of everything, and even though it might be done through telemedicine, I might be sitting in Chennai, but we'll take the whole history. Okay, we'll spend enough time, and we'll try all the options, and if all the options don't work, then only we use
medication. All right, and so like you've been saying, you how long are you going to be here in the Seychelles?
I'll be here till this Saturday.
Okay.
And I'm coming back in 3 or 4 months time. And I'll be coming here regularly. I do like Seychelles. It's nice, beautiful.
You never know, you might decide to come live here.
I mean, like, who can miss these beautiful beaches? So I'm looking forward to come back and see people through telemedicine, and even in person. If you have time to come, just come and check. Okay, see how I
Please
look.
do. Please do. Come check out. He looks. Come check out the work. Again, like they say, been saying, they have a great team lined up for you. Different. They have an expert in psychiatrists, experts in clinical psychologists, professional counselors, speech therapists, occupational therapists, recreational trainers, nutritionists. Of course, all of these are team members that you might encounter if you do decide to come to me, and they do find a need to slot you in. So, Dr. Kurunji, thank you for coming through here today. It's been a pleasure discussing these with you. I hope to everybody listening that you guys have gotten a better understanding and feel a little bit more at ease with the information that you've heard. Don't forget, the 26th of February, between the 26th of February to March 2nd, 2024, over at the Miyot International Total Eye Care on the ground floor of Espas building. You can find the clinic, and they have a special consultations that is going on. 30 minutes. The first 30 minutes is free, and every 15 minutes after that is 50 rupees. So if you do want to come through, check up, you never know what it is you might find. You might find nothing, but it's never going to hurt, right? It's never going to hurt. It's your mental health after all, right?
Yes, please. Thank you very much, Derek, and it's been a pleasure. Okay, I really enjoyed the conversation we had.
It is. Thank you for coming through. More music coming your way, guys. Stay tuned in. Palo Ken pa.